Hi, let's talk about the neurovascular structures that serve the pharynx. So the pharynx is innervated by the pharyngeal plexus. This is a neural plexus, and there are three main inputs here. There's the glossopharyngeal nerve, cranial nerve number 9, the vagus nerve, cranial nerve 10, and the superior cervical ganglion, which provides the sympathetics to the neural plexus. Now, the glossopharyngeal nerve is the predominant provider of the afferent to the pharyngeal plexus. It's important to note that this does not serve the nasopharynx. The nasopharynx is served by a branch from V2, or the maxillary division of the trigeminal nerve, not by the pharyngeal neural plexus. Another important thing to note about the glossopharyngeal nerve is that it provides the motor innervation, or the efferent, to the stylopharyngeus muscle. Now, the stylopharyngeus muscle is there. There's the other, and we can see that very close relationship between glossopharyngeal nerve and the stylopharyngeus muscle. The vagus nerve, cranial nerve 10, is the bulk of the efferent to the pharyngeal plexus. Exceptions include, obviously, the glossopharyngeal nerve serving stylopharyngeus, so not to stylopharyngeus. Another exception is that the vagus nerve, or at least the contributions to the pharyngeal plexus of the vagus nerve, do not exclusively serve the cricopharyngeal part of the inferior pharyngeal constrictor muscle. This would be the recurrent laryngeal nerve that does so. So, cricopharyngeal part of IPC is served by both the pharyngeal plexus as well as the recurrent laryngeal nerve. And then finally, we can see, kind of nestled off to the side here, some examples of, these have really been reflected away quite well, but there is one of them there, and there's the other there. The superior cervical ganglia provides the sympathetics to the pharyngeal neural plexus as well. In terms of the vasculature to the plexus, the bulk of the blood supply to the plexus comes from this artery here, which is the ascending pharyngeal artery. And that comes off of the external carotid artery. So we've discussed the neural inputs to the pharynx, as well as the bulk or the dominant blood supply to the pharynx. I thank you for your time.